Alrighty then, let's start our next video about infant senses. And again, we're going to try to keep this to 15, but I think this is going over because there's a lot to say about developing infants, their growth. And even though I named it infant senses, I'm really actually, because I really think I want to draw your attention to how amazing it is that infants are using their sensations to just become people. So, what's so fascinating about infants is how they're touching, feeling, learning, and putting everything together. And so, one of my goals in this class is to really give you what you need to know to get out of your own experience enough to put yourself into the experience of another developing human being. Like, where are they at in this stage? And so, that's sort of my focusing on senses. What do they feel? What do they see? Um, and let's just get started. But the first thing I'm going to say is mostly pertaining to the first month of life. Right out the gate, infants have reflexes. They're born doing things that are pre-programmed behaviors. Reflexes are not learned. All babies do them, unless, of course, there's something, not working right. But all normal babies do these reflexes. And so there's a number of them. And if we were in class together, I would have us watch some of these very short videos, which are pretty terrific. It just shows what a baby looks like when you brush the baby's cheek, how the baby turns toward the mother as if to begin nursing. That's the rooting reflex. And then I have some sneezing examples of baby sneezing just because it's adorable. And then this one is kind of like crazy. It's like an old timey video of a infant, a newborn swimming. So you can really see the swimming reflex, which is fascinating. But one of the things that is like, why do infants have reflexes? It's probably to help them survive. So rooting, which is turning toward the breast to eat, and let's see, sucking, obviously, and gagging, those are all reflexes that would be related to nutrition, to getting food, to eat, to eating. But then some of these others may be related to survival, like the swimming reflex. Who knows? Maybe during our evolution, we used to have water births. I don't know. We don't know. The fossil record doesn't tell us. But the stepping reflex, um, uh, some of these, the blinking and the sneezing, these are like related to irritants. Like if something gets in their eyes, or if they inhale dust, it like clears their pathways, it clears their eyes. So these are all really healthy things for babies to have, and it keeps them safe. And it's interesting to understand that like some of these reflexes and some of these senses are used in research to understand what infants can do and what they can learn. And one of the things I thought was interesting to tell you about was how sucking is an indicator of a preference for mother's voice. In fact, I'm going to talk to you in more detail about this when we talk about learning and how even at 1 or 2 days old, you can teach a an infant to associate their mother's voice with a certain rhythm of sucking, and in doing so, they will suck in that rhythm more frequently so that presumably they can hear their mother's voice instead of someone else's voice. It's really cool. And so researchers are using this basic reflex that an infant's going to do at any time to set up these experiments that say, wait a minute, or, you know, do 1 day olds learn? You bet they do. And the sucking is a useful way of proving that. Also, there are other findings. For example, um, infants who are born cocaine addicted have a stronger sucking behavior for sweet liquids. And also, you think of like sucking as being, a mouth thing, and it is, but they've also found that it's a hand thing, that babies move their hands while sucking. And in doing this, the use of the hand actually, they measured the levels of oxytocin, which is a hormone in the mother's body. It increases the mother's oxytocin, and that hormone is associated with love and warmth and bonding and care. So what the baby is doing is actually changing the mother's physiological experience, and creating a higher propensity for the mother to be caring of the baby. So within sensation perception, like we can just start with sight. Babies can see. Now, what they can see is presumed to be more blurry than what we can see. Here's what we would see in black and white, of course. And here's like the babies is more likely to, the newborn is more likely to see it as blurry. But one thing that we can see that we know that they see is when presented different stimuli, and when researchers measure the length of time that they look at stimuli, they can see that they spend more time looking at images with sharp contrasts, and they stare longer at blue or green objects. What does that mean? All we know that it means is that they can distinguish between them. Because if you showed a blue and a yellow, and if they didn't distinguish between them, they'd look at them the same amount of time. But because, one is statistically significantly longer, the blue, it means that they're distinguishing between the blue and the yellow, and there's some sort of preference for looking at the blue or the green. So the other big story in newborns and infants is their preference for faces. So this is research done by Slater, and he's summarizing a number of researchers who have found that newborn infants within just a few hours of birth can distinguish between faces, particularly the mother's face. So if they have, like, this is hours, man. So here's a stranger's face, here's the mother's face. The infant prefers looking at the mother's face than the stranger's face, which is interesting. And this holds true even when the real faces are presented to the baby and in video representations of the faces. So fascinating. Now, one of the things that is a little bit interesting is this idea that babies, even newborns, mimic faces. And I think this is an example of something that was largely believed, that babies mimic faces. But this is an example of how maybe with more rigorous research, they're really actually not able to prove that this is true. In this research here that I'm referring to, I think it was somewhere in Australia, they were trying to replicate this research. What they found was that babies would stick their tongue out, yes, in response to a researcher sticking his tongue out, but the baby would stick his tongue out in response to any gesture. So there was no real pattern there. And so doing rigorous research is important to just make sure that we're not believing everything the first time a study finds it. That's why replication is important to doing this type of research and understanding development. One thing that is also fascinating about infants and faces is that they don't habituate to faces. So habituation is an important concept in understanding infant senses, because there's a tendency for infants to sort of attend to the new thing and give it attention until it gets used to it. If it stops changing, if it's the same stimuli, the baby will start looking around and turn their attention to something else. And so that is true for video faces. It is true for audio video objects. It is true for video objects, but it is not true. Wait, what does this mean? Visual and audio visual. So audio visual faces they never habituated to it in this research. But over time, the attention paid to video faces, audio video objects, or video objects just decreased. So I like this chart because it shows you that this is sort of their um, um, number of times toward their until their attention was lost. And it also shows you that as they grow, 2 months old, 3 months old, 4 months old, 6 to 8 months old, they spend less time habituating to these types of stimuli. But all throughout this time, if they see audio, video, visual faces, they never habituate. They just continue to look um, uh, to the same degree. Something like that. Okay. Another thing that's interesting about vision is that they can see by about they've got binocular vision, and that means they can start to have depth perception. And so by 6 months, the baby's vision is as good as an adult's. And babies between 6 and 4 months would not cross a visual cliff. So this is a paradigm that they use to study many things. And in this case, I'll show it to you again later when we're talking about social referencing. But this shows you how the baby is on plexiglass and it looks like the floor drops out beneath her. And so they use this to see if the baby can see what's going on. Hearing is evidence that the newborn hears is that they react to sound. You startle them, they'll move. Here's a YouTube that shows a startle in place. They recognize familiar sounds, and they stop crying when they hear their own cry. This is interesting. They can hear and distinguish things, fine details in the sounds that they're hearing. Sound localization is harder for infants than it is for adults for the simple reason that their heads are smaller. Like one of the ways that we know how to turn our head in the direction of the sound is because the sound waves get to one ear before they get to the other ear. And then we go like that. But it's harder to triangulate if your head's smaller. Infants are also known to react to melodies, different types of melodies. And even a 1-month-old can distinguish between ba and pa. And we'll talk more about this type of hearing when we talk about language development. Another thing that goes along with this hearing and sight development is rapid increase in growth spurts in neurons in the brain. Smell and taste. 10 to 18-day-old babies can distinguish the smell of their mother. They would have like nursing pads that would either be neutral with no mother nursing smell on it at all, or the nursing pads, and the babies would prefer the mother. Babies prefer sweet tastes and the foods that the mother ate, and that's an evolutionarily adaptive, that babies prefer the food the mother's eats because we talked about it before. The human being's secret sauce is because it adapts to its environment. So if you're living in an environment where there's nothing to eat but whale blubber, babies are predisposed to come out the gate like in whale blubber. I think I'm exaggerating. I don't think they tested whale blubber, but I think they tested things like lemons and kimchi, I think. Ugh. I'm not predisposed to like kimchi. Anyway, what's adaptive is that the culture of the group has adapted to leverage the environment, and then the baby itself comes out of the mother physically predisposed to like the kinds of food that's been eaten by the mother. In terms of pain and touch, we know that babies experience pain because there's an increased heart rate, they sweat, they have facial expressions, they cry, things that are associated with what would be assumed to be painful. The reaction time to pain may be slower in babies than adults, and there is some evidence that extreme pain in infancy may be related to greater sensitivity to pain in later life. It's also, when we just think about touch, the mouth is a touch organ for infants. That's why they take everything and they put it in their mouth because they're trying to understand it by touching it with all of their um, amazing number of sense receptors, touch receptors in their mouth. Another thing to know about touch is that gentle massage instigates growth. Babies who are gently massaged actually grow more. Within sensation, there's the multimodal perception, and this is considers information that is collected by various individual sensory systems and how it's integrated and coordinated. So in social science, as we try to understand complex systems, we take a component of a process and we study that component. So the component might be touch, or the component might be sight, the component might be hearing, but the truth is all of this is happening all at once. And the babies are integrating both the taste of a thing and the touch of a thing, and the sound of a thing and the taste of a thing, even. Like, all of this is what they're using this to understand their world. So now I'm over time, but I'm going to just keep going quickly and let you know that there are a few things about neural development, especially in terms of the degrees of connection that get expanded on at birth. 1 month later, more connections. 3 months more. 15 months, 24 months, a whole bunch of connections. 2 billion connections are formed. But one thing that's important when we're thinking about neural development, and this will come up as we understand development across a lifespan, is that there's a thing called synaptic pruning. A synapse is another way of saying the connection between neurons. And if these connections aren't used, they die away. They get pruned away. The connections are. And the other thing to remember when we're talking about neural development is myelination. So connections and neurons that are used a lot, and neural connections that are used a lot, they get insulated so that the signals can send faster signals. So myelination is a fatty substance that surrounds the tube, I'll just call it, or the cord or the wire of the nerve that travels distances. And if that tube is covered with this fatty substance, then the signal just zips through it. So it's sort of the use it or lose it principle, and it's the optimization of neural pathways that gets used through myelination. Those are both important to development. Another thing to consider about neural development is how much the environment can impact growth. So like here you have a normal 3-year-old child's brain and this very sad picture of a child who experienced extreme neglect. It's the same cross section, the same point in the brain, and you can see like it's nowhere near as big, it's nowhere near as healthy. So one of the things that's happening in all of this, all of these connections that we're growing and we're building between neurons, is our brains are getting bigger and heftier and fattier, right? Because the much used pathways are getting reinforced by myelination. But what might be happening here is that there's just less stimuli. It's been known that children have been raised in dark rooms. They're just not given anything to explore. They're afraid to make noise. In extreme cases, it just would lead to a vast difference in the growth of the very substance, of the very physical substance. I want to just say 2 words about shaken baby syndrome. I'm sure that nobody in my class would do this, but it's just very important to know that you can't shake a baby. That if you shake a baby roughly, you're going to give them a concussion. Their brains can't handle it. 1 in 4 shaken babies die. Those who survive may have terrible problems. Even 1 shaking can be devastating. And those found guilty of shaking can go to prison. So there's that. Moving right along, I'm going to say a bit about motor development. Gross motor skills are the big motor skills, the large motor, as opposed to fine motor skills, which are these little pincer type things. But gross motor skills are like walking, etc. Big muscle groups is a way to think of it. And so I just wanted to give you this sort of chart of what comes online when on average. So for the first 3 months, the big, um, bringing your hand to your mouth, like, oh my God, it's so funny to watch little babies just learn to find their thumb. But that's a great accomplishment in the first 3 months. In this 3 to 6 months, they're able to roll, they're able to reach with both hands, they can pass things back and forth. Now you can sort of stick them on their legs and they may be able to support themselves a bit, and they can sort of pivot on their bellies. That's why they say to give infants belly time, because you don't put your infants on their bellies when they sleep. We'll get into that. But so when during the day you want to put them on their bellies so that they can get experience with the gross motor skills associated with being on your belly, like picking up your head, and etc., and rolling around. 6 to 9 months, they're playing with toys, they're sitting up, they're kind of able to crawl possibly. 9 to 12 months, they're probably definitely sitting in a position without help. They can pull themselves up to stand, take a few steps while holding onto furniture, which I like the name. They call it cruising. I like that. And they may stand without support, and they may take some steps without support. So I'm just giving you a nice video to watch here about cute babies crawling. Just so cute. And in this case, one of the points that I like to make with this video, should you choose to watch it, is just to notice the degree to which the baby's interest and excitement is involved in their crawling, in what they're crawling to. So in this video, and the same is true in the walking video, usually there is like, in almost all of these cases, they're going towards somebody like who loves them. So I like to show the videos to really emphasize the sort of multi-component aspect. It's not like you're just crawling to crawl. You're crawling to get somewhere. You're learning to walk to get somewhere. And that's a really important thing to remember when thinking about all of these systems interacting. Another thing to think about with walking is this idea of the norm. And one of the things that developmentalists often do is they want to understand what the norm is. So to get a norm, you take a large sample of people at a given age and you see whether they can walk or not. What percentage of them are walking at that age. So here, you have, let's see, where does it get to be more than 50%? By 12 months of age, see, this is 50%, more than half of the babies are walking. And then it rapidly increases. And by 16 months of age, probably 98% of the babies are walking. So that's how you would read this chart. Fine motor skills, grasping, reaching, manipulating. I don't have a lot to say about them at this moment, but we'll look at this in more detail, and we'll be thinking about grasping, reaching, manipulating when we're thinking about infant learning. The dynamic systems theory is really making this point that it's this interplay of many different systems. Vision, hearing, taste, muscles, nerves. I also propose emotions is how all of these work together, and that the babies are needing to integrate all of these things. And so I actually really like this video, which shows it's just a pediatrician's advice in terms of what to think about when buying toys for infants, and really how to think about the things that they love to do. It shouldn't be about how cute you think that giraffe is, but to think about what is it motivating them to explore their world, and how do we think about this dynamic systems theory when we think about the toys that we may want to get for babies to engage in. Nutrition, breast is best? Um, this is such a big topic, and I'm not going to have time to talk about it in the degree that it should. But there's just so many benefits to breastfeeding. Not to mention, I added this one. Most of the textbooks don't really talk about how much easier it is to breastfeed, but in my experience, it's a heck of a lot easier than sterilizing bottles and mixing formula and worrying about whether you're introducing bacteria into your formula and then having to clean them exactly so that they're not, so that they are clean enough for the baby. With breastfeeding, it's all really easy and you can do it anywhere. You don't have to pack a bottle. Just, you know, find find a tiny bit of privacy. Although breastfeeding is legal, so they can't tell you you can't breastfeed your child anymore. Um, when long about uh, uh, just after 6 months, it's time to start introducing solids, but the recommendation is to think about whether your baby is ready. It's not about the time, like, oh, it's 6 months, time to give the baby food. It's again another developmentally a question about whether it's developmentally appropriate. So here are some questions you can consider when introducing solids, like can your baby hold his or her head up steady? Can your baby sit without support? Is your baby mouthing his or her hands or toys? Is your baby showing a desire for food by leaning forward and opening their mouth? Like that's how you know the baby's ready, when the baby tells you that they're interested in it, they're strong enough to do it, they're coordinated enough to take in this process, this um, substance. So, what foods to start? Baby cereal, pureed vegetables, definitely no milk or honey before age 1, and no choking hazards. And quickly, infant sleep is a really big topic when it comes to the physical development of infants. And here I'm showing you a very brief sort of what to expect about infant sleep. So they tend to sleep in fits and starts at the beginning, and by 4 months they're going to sleep in longer stretches. All of this is highly dependent on your child and also on what you do. In some cultures, babies may be sleeping through the nights, but your cultural practices may have the babies sleeping in smaller increments. Um, the baby's type of sleep is different than an adult's. Half of the baby's sleep is REM-like. That's for adults. Only 20% of our sleep is REM-like. That's where the dreams and so and then at 3 to 4 months is when dream-like brain waves appear. Sudden infant death syndrome is an important thing to consider, and I have here a list of risk factors for sudden infant death syndrome. Um, when So in some ways, this kind of bothers me because I'd rather tell you what to do instead of what to not do. But this is a list of what not to do. So don't put babies to sleep on their stomachs. Be concerned about the babies overheating while sleeping. Don't put them on a surface that's too soft, because one of the concerns with sudden infant death syndrome is that their breathing, their exhale may be preventing them from getting enough oxygen. So what you want is the baby to have airflow, um, and plenty of oxygen available and flowing around their face. So another problem with SIDS is mothers who smoke during pregnancy or exposure to passive smoke after they're born. Mothers who are younger than 20-year-olds at the time of their first pregnancy are more likely to have babies that experience sudden infant death, which is sad. Um, Babies born to mothers who had little or late or no prenatal care. So prenatal care, and that might not be causal. It might not be that, oh, prenatal care will prevent your baby from having um, sudden infant death syndrome. This is an example of a correlation, right? It may be that mothers who seek out prenatal care are also going to seek out best practices when it comes to caring for their child. And there you let's go on. And the last thing I'm going to say, we're at 30 minutes. The last thing I'm going to say is that baby boxes are something that they do in, I think, Finland. And every new mother gets a baby box, and so it's a box that's specifically designed for a newborn to sleep in. And they fill it full of wonderful goodies like onesies and diapers and a pacifier and cloths and um, all these great, like a blankie. All of these are great things, and this practice, which you can look look at in this video, has led to a significant reduction in sudden infant death syndrome.